Hello and welcome to another live broadcast with Medstar Health. My name is Michelle Bowman and today I'm joined by colorectal surgeons Dr. Nicole Chaumont and Dr. David Lisle. Today we're going to be discussing a medical issue that impacts so many people yet can be a bit uncomfortable, perhaps even embarrassing to talk about: hemorrhoids. So stick around, give us a like to let us know that you're watching, and ask us your questions in the comments below. We're going to take some time to answer those as well. So before we dive into our questions, let's get to know a little bit about our experts today. I'll start with you, Dr. Chaumont. Could you tell our viewers a little bit about yourself and your background at Medstar Health?
Well, like you mentioned, my name is Nicole Chaumont. I'm originally from Florida and kind of spent the last 10 years bouncing back and forth between Florida and North Carolina, where I did my training. I am trained in general surgery and colorectal surgery. I guess a little bit about myself. I joined Medstar last summer, moved from North Carolina. And a little bit about myself, I guess a lot of patients ask me in the office why I chose to do this for my career. And I'll say that in general, I like making people feel more comfortable, and I like helping them get better. And it turns out that nothing makes people more uncomfortable than a problem that has to do with their bottom or their hemorrhoids or their butt.
Well, thank you very much. Thanks for joining us today. Dr. Lisle, same question. Could you tell our viewers a little bit about yourself and your background?
Yeah, so I'm also trained in general surgery and colorectal surgery, originally from Southern Ontario, pretty close to Toronto, so I'm a Canadian. I've been in the US now for probably over 20 years now and did all of my training and education down here. And I was in Florida and New York, and I've kind of been all over the place for education and training, but I've been in Baltimore now for the last 4 years with Medstar and love it here. A little bit about myself. I have a 2-year-old, and I'm also married to a colorectal surgeon. So our dinner conversation is lively.
I can imagine. Well, thank you both again for joining us. Let's get into our questions. So Dr. Chaumont, I'll start with you. What exactly are hemorrhoids?
Well, first off, I'd say that they're a normal part of the body. You know, a lot of people think that they're not, but they are. We often describe them as these vascular cushions that are in your distal rectum or your anus. I think that's hard for people to understand. So I try to get people to imagine that they're just like a little cluster of veins that are normal, and that sometimes they get swollen and that sometimes they're not swollen, and they basically help us with continence or bowel function.
All right, great. And how common are hemorrhoids? Do they just happen to a certain portion of the population, or can anyone of any age or demographic get them?
Well, they are very common. In fact, we all have them. So me and you and Dr. Lisle, we've all got hemorrhoids. Like I mentioned before, they're a normal part of the body. And I think that they only become problematic if they become inflamed or swollen, or because of some of the issues that we'll probably talk about later. But everybody's got them.
That's something I did not know. So
Most people don't.
every day. So what are the possible causes of hemorrhoid inflammation?
Yeah, so, you know, like I mentioned, there are these little clusters of veins. And so things that cause them to get swollen or inflamed or straining during bowel movements. If you do something that requires you to sit for long periods of time, especially sitting on the toilet, can cause them to get swollen or inflamed. People that have issues with constipation or chronic diarrhea can sometimes have a lot of hemorrhoidal symptoms. Diets that are low in fiber, pregnancy, obesity, things like that can cause these little veins to get swollen in your bottom, and then they can cause you symptoms.
Okay. Well, thank you very much for explaining that. I'll go over to you, Dr. Lisle. What are the symptoms of a hemorrhoid that is inflamed?
Yeah, so hemorrhoids can present in a variety of different ways. They can most commonly, so there's both internal and external hemorrhoids, and they're a little bit different. Internal hemorrhoids often bleed, and so people can notice blood in the bowel movement, sometimes on the toilet paper or in the toilet bowl. It can be sometimes a significant amount of blood, and sometimes it's just a small amount of blood. Other times they itch or they prolapse. People can notice them coming in and out. They can be uncomfortable. Those are the most common presentations.
All right, and what are the key symptoms or indicators that it's time to get medical treatment?
Well, I think it's always a good idea with anything like this, if there's a symptom that's concerning, if you have any of those symptoms that I mentioned, that you seek medical advice and come see a colorectal surgeon or your primary care doctor. It's always better to find out earlier than later. Oftentimes, if we find hemorrhoids early on, we can counsel and do things that are more conservative to help prevent them from getting worse in the future. So I think as soon as you notice any of those symptoms, it's a good idea to seek counsel.
All right. Dr. Chaumont, can you explain what treatment options are available for people who may be experiencing these symptoms?
Well, there's a lot of different treatment options for hemorrhoids. I think basically we kind of split them up into things that we can do for you in the office and things that require more formal surgery. And like Dr. Lisle mentioned, we tend to split hemorrhoids up into internal hemorrhoids and external hemorrhoids. And for the most part, the office-based procedures are treatments that are directed toward internal hemorrhoids. For various reasons, the most important being that those tend to not be painful to deal with in the office, where external hemorrhoids can be a little bit more painful. So in-office procedures tend to focus on internal hemorrhoids, and then the more formal surgical procedures tend to focus on either internal hemorrhoids that haven't responded to less invasive measures, or external hemorrhoids that have just become so symptomatic that something needs to be done about them. And that's without going into all the details about all the different procedures.
Great, thank you. So you talked about the in-office treatments, but are there any at-home remedies or over-the-counter medications that people can take to help with their hemorrhoid symptoms?
Sure. If you've ever been to a drugstore, there's usually a whole section where you can look for things that will help you with at-home remedies for hemorrhoids. But in general, I think, we focus on the things, we mentioned all the things that can cause them, like prolonged sitting and constipation or diarrhea. And so a lot of times the at-home remedies are focused on these things. And so, we recommend that patients focus on hydration so they don't get dehydrated or constipated. We focus on increasing fiber in diets, like with vegetables and fruit and things like that. And if patients or people can't get enough fiber through their diet, then there are things like fiber supplements that you can take to help you. And all of these things essentially are aimed at reducing or making it easier to go to the bathroom so you don't have to strain, so you don't sit there for a long time. And so it's easier to pass the stool when you do have to have a bowel movement. And then there's some topical like anti-inflammatories that you can find from various different brands. And those can sometimes help. It's hit or miss whether they help, but sometimes they do.
That's awesome. Thank you very much. At this time, I want to pause and welcome our viewers. Thank you very much to everyone for tuning in today. I'm joined by colorectal surgeons, Dr. Nicole Chaumont and Dr. David Lisle, and we're talking all about hemorrhoids. We have more to discuss, so please stick around, share this broadcast with your friends, and give us a like to let us know that you're watching. So let me go back to my questions. I'll turn it over to you, Dr. Lisle. Could you share some information about the surgical removal of hemorrhoids and what that process is like?
Yeah, absolutely. So I think you'll hear us emphasize this over and over, and Dr. Chaumont has already done that. But I think one of the take homes here is that the majority of hemorrhoids don't require surgery, and there's a lot of things that we can do to optimize people's diets and lifestyle modification that can prevent us from having to do a surgery. So I think that's an important point to make up front. There's a lot of various procedures, a lot of them in office that Dr. Chaumont also mentioned that are for internal hemorrhoids. And then there's obviously surgery that we used when other options haven't worked, or the hemorrhoids have kind of progressed and are unlikely to respond to some of the office procedures that we have. So there's, for internal hemorrhoids, there's rubber banding. We can sometimes inject them with sclerotherapy in the office. And then when those things don't work, or we have, severe hemorrhoids, that's when we talk about surgery, which is also a very good option, and for the right patient, the outcomes are great, and the symptoms tend to resolve with surgery. And essentially, it's a same-day procedure. So patients come in and are put to sleep for that. We put them to sleep usually for hemorrhoidectomies because it's a little bit too uncomfortable to do in the office, and we surgically excise the large hemorrhoids in the operating room, and then we usually sew the defect closed, and then they go home the same day and recover at home.
All right, awesome. That's good to know that you can get that all done in one day. And that's a great segue to my next question of how does a patient know that it's the right time to get a procedure? And do they go to their primary care physician first and get a referral, or what can you walk us through that process?
Yeah, absolutely. I think it's as I said at the start, I think it's always a good idea to act early on these things, because the answer to your question is you wouldn't know, or you shouldn't know when it's the right time to have surgery. That's our job. And so I think going to see a professional who understands when it's time to act and to do surgery versus another procedure, or whether we can just treat this conservatively by increasing fiber and water in your diet. That's why you come to see us. And so I think from a starting point, going to see your primary care doctor is a good start. Oftentimes that's necessary for a referral to begin with, but we're always happy to see anybody that has any issues with their hemorrhoids or are concerned about hemorrhoids in our office here as well.
Great, thank you. So Dr. Chaumont, this isn't the most comfortable topic to discuss or even experience. So what do you say to someone who may be hesitant about calling for an appointment?
I would say I can understand the discomfort with talking about it. I can understand, a lot of times patients, when they come, they're mostly uncomfortable because they feel like they should know what's going on. They say, I don't even know if this is a hemorrhoid, or I don't know what's going on back there. I can't make sense of it. And all of that, just like Dr. Lisle mentioned, you're not supposed to know what's going on back there. That's our job. And the other thing I can say is that while it might feel embarrassing to talk about it, or you think you might be embarrassed, I think knowing that everybody has hemorrhoids, knowing that we see this all the time, knowing that you don't have to live with the symptoms that you have, and that oftentimes we do have things that can make you feel better. And that doesn't necessarily mean surgery. I mean, a lot of what we do for hemorrhoids is really education and talking to patients about how to prevent them and how to deal with the symptoms when you do get them. And then sometimes, there's an operation or a procedure that we can offer to make it better, but a lot of times it's not going to result in that. And we can kind of explain that to you and give you all the information. And I think once you have the information, then people tend to leave the office a lot more comfortable than when they got there. So the first step is just coming in.
Thank you very much. So could you also explain, Dr. Chaumont, why Medstar Health is an ideal place to choose for care if you are dealing with hemorrhoids?
Well, I think we have an experienced team. Dr. Lisle and I work together, and we have 2 other partners. And between the 4 of us, I would say that we're pretty easy to talk to. I think that we are a little bit light and can make most people feel comfortable talking about this stuff. And I think that we can offer you the whole range of treatment options, and are, focused, are patient-centered, and we'll focus on, what you want to do and where you are and what you're looking for, and not necessarily try to get you to the operating room or get you to surgery, but get you to where you're trying to get to.
Thank you. Yeah, that's always good to hear as a patient. You want your physician or your specialist to help you feel at ease. You're already going through a stressful situation, and hemorrhoids doesn't make any better, doesn't make it any better. So it's always good to have a good team of physicians there to support you. So thank you. So I'll turn it over to you, Dr. Lisle. What would be the next step for a viewer with symptoms who would like to come in for care?
Yeah, I think reaching out to our office to potentially be seen and schedule an appointment. Our number in the office here is 443-777-2475. And that we have offices actually all over the Baltimore area for convenience. So Dr. Chaumont mentioned that we have 2 other partners, and we try and station ourselves across the area so that for convenience for patients. So we have offices in Bel Air, at Harbor Hospital, at Good Samaritan Hospital, and here at Franklin Square. So that number will allow you to reach any of us and all of those offices so that you can schedule at the one that's most convenient for you.
Perfect, perfect. We received one question from one of our viewers. Her name is Lynn. Thank you for tuning in and sharing this with us. They say, can you talk about the banding procedure? She says she had it done, and the large protruding one, she had that. Let me reread that question. I had it done, and the large protruding one I had that drove me to have the procedure is still there. Afterwards, my NP said they weren't supposed to go away. So now I'm confused, as I thought that was the whole point of the procedure. So I'll toss it to the 2 of you, and one of you can tackle that as you please about the banding procedure.
Yeah, so rubber banding is a great procedure for internal hemorrhoids, for the appropriate internal hemorrhoids. So we really decide on what modality of treatment to use for hemorrhoids based on the size and the grade of the hemorrhoid, as well as the severity of someone's symptoms. So using rubber banding as a technique is good for grade 1 and 2 or more minor hemorrhoids. And sometimes we use it in grade 3 hemorrhoids, which are a little bit larger, but it has a lower likelihood of responding to with larger hemorrhoids. And so occasionally it can be refractory or unresponsive for larger hemorrhoids using rubber banding. And then in those cases, a different procedure might be a better option, like a hemorrhoidectomy. I think it's important to remember, and Dr. Chaumont touched on this before, that our goal with treating hemorrhoids is to improve the patient's quality of life. We're trying to get you to your end goal, and you've come to see us in the office because you have a concern or a symptom that is that's impacting your quality of life and making it harder to live. And so our goal is to improve those symptoms so that your quality of life is better. And so sometimes that's just education and reassurance, like Dr. Chaumont mentioned, that we all have hemorrhoids and that they're there. And if you're not having any symptoms from them, if there's no prolapse or pain or itching or bleeding, then sometimes it's just reassurance that this is a normal thing that we all have. And in other times, if it's symptomatic or bothersome, then that's when we need to discuss if there's other options or treatment that we can optimize your quality of life. So you can see how it's very nuanced, and having a discussion to make the care specific to each patient is important.
Absolutely. Thank you very much. That's all the questions we have for today. Thank you so much to Dr. Chaumont and to Dr. Lisle for taking the time to speak with us today. Thank you to everyone for tuning in and sharing your questions and comments with us. For more information about our services for hemorrhoids, please take a look at the link in the comment section. We'll have more information as well for you on our website. Thanks again, and we will see you next time. Bye.
Thank you.
Thanks.